First up, let's go to epidemiologist, Chair of Epidemiology at Deakin University, Bennett. Thanks for joining us, Catherine. Can the New South Wales health authorities continue their run here and get on top of this outbreak without forcing a citywide or statewide lockdown?
Oh, everybody hopes so. I think they're doing a great job with the contact tracing. They're really on top of those chains that they fully understand. But of course, there are those still 2 cases where they don't know how they link back to the cluster. That is the concern, that missing link means other people might have been also infected who aren't associated with the exposure sites, but are associated with this missing link, who probably doesn't even know that they're a case. There might be 2 of them. So that's what they'll be watching for in this next couple of days. That testing rate, that 48,000 people tested yesterday, 44 the day before, that's really important so that the health department has confidence that they're not missing cases.
Catherine, just your thoughts on the way to go forward from here, the way Singapore is talking about a new normal, and that even with the levels of vaccination we've got in Australia, with most of the elderly, the vulnerable vaccinated, at least with a first shot, we should be starting to talk about numbers of people ill or hospitalised rather than focusing so heavily on the numbers of infections.
You're right, Chris. At this stage, they're still aimed completely on zero tolerance, so trying to get back to zero every time we see one of these crossovers into the community. The vaccination itself will make, firstly, that process easier. We've already seen in this super spreader event in New South Wales, that 4 or 5 people there who are vaccinated aren't among the cases, and yet they have 11, possibly 12 cases already amongst the other 24, 25 people. So, in fact, vaccine will make a big difference even in this interim period while we're still trying to keep to zero until we've got the background rates in the population higher. But it'd be good to have some targets. It would be good to say, this is the level we're looking at where, there might be extenuating circumstances, and we'd explain that at the time. But as a general rule, we wouldn't need to even look at circuit breakers, because we should have slowed the virus down enough that we can trust our excellent contact tracing.
Yeah, hope we get there as soon as possible. Good news today, though, also about the amount of Pfizer vaccines that we're expecting to get into this country starting next month.
That's right. This is the second half of the year. We're here now, and that will start to increase supply. And just widening that feeding line will really help get the doses needed out to each of the states. So that's going to start to really help things move along quite quickly, I would think. So very good sign that our supplies, not only for Pfizer, but later in the year, Moderna comes into the mix as well. So that will really help lift the coverage for those in the under 50s.
Catherine, thanks for joining us again.
Thanks, Chris.
Catherine Bennett, the Chair of Epidemiology at the Deakin University.